Greetings, everyone, and thank you so much for joining us today. Feel free to introduce yourselves in the chat, and we'll be getting started in just a few moments. It's so wonderful to see how many of you are here joining us today. Feel free to introduce yourselves and tell us where you're joining us from. And if you would like to access a live transcription and cannot see it now, click the Show Captions icon in the Meetings Control toolbar at the bottom of your screen. If you have any questions or need assistance, you can message the panelists. We are thrilled to see so many of you here with us today. So without further ado, I'm going to go ahead and get started. And feel free to continue introducing yourselves in the chat. My name is Sheila Vicaria, and I am the Managing Director of the Drug Policy Alliance's Department of Research and Academic Engagement. This webinar will be recorded and be made available on the ASDN website after the event is over. We at the Drug Policy Alliance are honored to be co-hosting this event alongside the National Prevention Science Coalition and the Addiction Science Defense Network, the official launch of the National Impact Report entitled Addiction Science Under Siege, the 2025 Impact of Federal Actions on Research, Prevention, Treatment, and Recovery. Check out the link in the chat to download the report and other materials because they've just been released fresh off the press today. Let me tell you a little bit about those of us who are co-hosting this event. First of all, the National Prevention Science Coalition envisions a society that fosters nurturing environments and caring relationships for the well-being of all. Its mission is to prevent social ills and promote well-being by translating scientific knowledge into effective and sustainable practices, systems, and policies. You can learn more about them at the link in the chat we will be sharing now. This event is also being co-hosted by the Addiction Science Defense Network, ASDN. It is an information exchange and action network for individuals and organizations devoted to studying, treating, and preventing problems caused by psychoactive substance use, including alcohol, illegal drugs, tobacco, and cannabis, as well as other potentially addictive behaviors such as gambling. The ASDN network includes research societies, addiction journal editors, practitioner organizations, programs, and others engaged in training of scientists and clinicians, as well as organizations that overlap with the U.S. addiction science community. You can learn more about them at the link we are providing in the chat as well. Lastly, I want to tell you a little bit about the Drug Policy Alliance, or DPA. We at DPA address the harms of drug use and drug criminalization through policy solutions, organizing, and public education. We advocate for a holistic approach to drugs that prioritizes health, social supports, and community well-being. DPA opposes punitive approaches that destabilize people, block access to care, and drain communities of resources. We at the Department of Research and Academic Engagement work to bridge the divide between research and effective drug policies. We provide research support to our policy colleagues to ensure that we're promoting the most evidence-based policies. We work with academics by providing media, advocacy, and research translation trainings, and we host events like these where we platform the latest drug policy data and research. And before we get started on today's event, I want to highlight two other events that are coming up that may be of interest to you. The ASDN has been hosting a series of congressional briefings this year. They've already done 5, and they are about to host their 6th and final briefing in June. My colleague Angel will drop the link in the chat so you can register and join. And we at DPA this spring have been hosting a 4-part webinar series entitled We've Been Here Before, Navigating Research in Challenging Times. And you can register for our final webinar in the link in the chat. So here we are today for a 90-minute webinar launch of the Impact Report. I just want to tell you a little bit about what we've got planned for these next 90 minutes together. I will first play a pre-recorded statement from New York State Representative Paul Tonko in support of protecting federal funding for life-saving addiction prevention, treatment, and recovery services because he could not be with us live today. Then we will hear presentations from 4 of the key collaborators of the impact report, and they will each be highlighting key takeaways and methods and findings from the report. As they present, we will share each of their bios in the chat. And then I will open it up after the presentation for a moderated discussion with some pre-prepared questions I have. However, there will also be time for your questions, so feel free to put your questions in the chat or in the Q&A box at any time, and we will be tracking them and collecting them so that I can get to them at the end. So before we go any further, I'm happy to now play the pre-recorded statement that we were provided by Representative Tonko's team so you can hear his remarks. I will play them now.
Hi, I'm Paul Tonko, representative of New York's 20th Congressional District. Throughout my time in Congress, I've worked hard to address the disease of addiction through my work as chair of the Addiction Treatment and Recovery Caucus and as the proud author of laws like my Mainstreaming Addiction Treatment Act. In recent years, we've made heartening progress on tackling addiction and bringing treatment and hope to the millions of Americans living with this disease. However, we all know that we have much further to go, and far too many continue to feel the pain addiction inflicts on individuals and communities. Now, we face another dire hurdle, as Trump and his administration have ravaged the agencies, programs, funding, and research that has helped pull so many onto the path of recovery. We know the cost of inaction to address addiction. It means lives lost. It means families devastated. It means communities broken. We cannot allow the years of progress made by dedicated advocates, scientists, researchers, and medical professionals to slip through our fingers. Now more than ever, we need to defend addiction research. Thank you to the Addiction Science Defense Network, National Prevention Science Coalition, and Drug Policy Alliance for producing this impactful report and for sounding the alarm on the impact of these harmful federal actions. And thank you, each and every one of you, for joining this conversation today. Know that I will continue to do all in my power to stand up for science and reverse these painful cuts. I am deeply grateful for your partnership in this fight, for the millions who are bravely walking the path to recovery, and for the universe of loved ones walking beside them. We cannot fail. Thank you again.
All right. And so we also received a quote of his statement, which we can share with all of you registrants after the event is over. So now I will pass it to Dr. Tom Baber, who will provide the initial introduction to the report. Tom?
Okay. Thank you, Sheila, for setting the scene for this webinar and for the logistical support provided by the Drug Policy Alliance. I want to begin by describing how this report came about, who contributed, and what methods were used to compile it. By way of introduction, let me say that the Addiction Science Under Siege report is an unusual document for several reasons. First, in the past, the main threats to addiction science has come from either the pervasive ignorance about the causes and consequences of addiction, or from the powerful industries that profit from addiction, including alcohol, tobacco, and more recently the opioid pharmaceutical industry. This report is unusual because it documents the threats from the U.S. federal government, which heretofore has been one of our strongest supporters. Second, this report is unusual because it was precipitated not by the search for answers to addiction-related questions, but by what was perceived to be threats to the pursuit of knowledge itself. So to get to the report contributors. The report's contributors include epidemiologists, information scientists, economists, neuroscientists, prevention researchers, former employees of NIDA and SAMHSA, as well as predoctoral and postdoctoral fellows. Several other contributors asked to have their names withheld from this list because they feared retribution as current or future grant recipients. As an aside, I have been an NIH grant recipient on and off for over 50 years, and I have never encountered a situation until now where scientists had to fear that their contributions to a scientific policy document like this would jeopardize their chances of future funding with the federal government. So how did this all get started? Next slide. The idea for this report and the real impetus for its development began on January 20th, 2025, when President Trump, on his first day in office, signed a series of executive orders, 5 of which dealt with addiction science and practice. Reading these executive orders, it became apparent that addiction research could be seriously affected by emerging policy positions of the Trump administration. In one fell swoop, they reversed decades of progress towards diversity, inclusion, global health, evidence-based drug policy, gender equality, and drug-related communicable diseases like HIV. The shockwaves created by these and other initial actions quickly resulted in a whirlwind of communications among people who had dedicated their careers to finding answers to the mysteries of addiction. Out of this, a virtual network was quickly formed to share information and monitor the impact of what was being done. Since then, there have been over 30 additional executive orders related to addiction research and treatment, most of them incompatible with scientific evidence, ethical standards, and public health. The next slide describes the current infrastructure of addiction science, and it consists of the things that we're most concerned about, not only the conduct of individual research projects, but threats to the entire infrastructure of addiction science. The infrastructure consists of numerous government research funding sources like the NIH, over 100 specialized scholarly journals, over 250 research centers where scientists can develop programs of study on a long term devoted to specialized areas of addiction, scores of professional societies that provide opportunities for scientists to share ideas and findings, a growing number of addiction studies degree programs, both at the master's and the doctoral levels, and thousands of scientists investigating genetic, biological, clinical, and economic and social aspects of substance use. The graphs at the right show the exponential growth in addiction research centers, both in the USA, which is the middle red line, and in other countries, the bottom gray line. Since the 1940s, it mirrors the remarkable growth in addiction science generally within the United States, uh, where the scientists have been leading the world in knowledge production and new areas of prevention and treatment. The next slide shows our conceptual model for studying the impact of the policies that are currently threatening addiction science. Most of the progress that has been made in this area has been through the financial support provided by the US federal government. And that funding has helped to build an infrastructure consisting of funding opportunities, research facilities, professional societies, scientific journals, career scientists, and all of this leads to the production of basic and applied knowledge about addiction. That product also has led in the past and continues to lead to improvements in public health. And when any of the parts of this infrastructure are interrupted or diminished, it could have effect on the downstream benefits of addiction science. So, what has been the benefits of this infrastructure? The next slide shows that uh, among the accomplishments have been the discovery of numerous causes and consequences of addiction. It's just not one thing, it's many things at many different levels of analysis. The benefits include development of programs that delay or prevent the onset of alcohol, drug, and tobacco use. We've also found cost-effective behavioral and pharmacological treatments that promote recovery. And we have now policy interventions that are based on evidence showing how different changes in the environment of a country, of a community, are capable of reducing the prevalence of addiction uh, and increasing life expectancy on a national level, not to mention uh, alcohol related violence and traffic accidents and so many other things. Um, so we've got quite a list of accomplishments. And finally, let me say a word about the impact reports methodology. We reviewed over 300 executive orders for their research implications. We monitored news articles from reputable medical journalists about the administration's actions. We analyzed grant termination data reported in medical journals and grant tracking databases. We interviewed present and former federal employees and center directors. We documented effects on prevention, harm minimization, and treatment programs. And finally, we analyzed the impact on research applications, grant awards, and addiction science publications. So with that introduction, it's time to hear from Liz Genexi, who will describe what has been happening to the world's leading source of scientific information, the National Institutes of Health.
Thank you very much, Tom. Hi, everyone. I'm Elizabeth Genexi, a former NIH program official of 22 years. I left in April of 2025 after DOGE ripped through, and I'll be focusing on what happened inside the NIH over the past year. Next slide. Before I get into what happens, I would think it's worth pausing to appreciate the scale of what we're talking about. NIH is not one institute of many. It's the world's largest funder of biomedical research and the institute for addiction science globally. With combined budgets at the National Institute on Drug Abuse and the National Institute on Alcohol Abuse and Alcoholism of $2.26 billion in 2025, these two institutes alone represent the backbone of addictions research. And this investment pays off. Economic modeling shows that every $1 of NIH funding generates $2.56 in economic activity. So when we talk about cuts, we're not just talking about less science, we're talking about a net income loss. Next slide. The first crisis experienced by NIH was the people crisis. In 2025, NIH lost more than 4,000 employees, roughly 1 in 5 of its entire workforce. Some losses were involuntary, as thousands were fired through formal reductions in force or probationary terminations. However, approximately 2,000 NIH employees simply chose to leave through buyouts and early retirements, like me. When your institution no longer supports scientific independence and asks program officials to participate in censoring science, Talented scientists will vote with their feet. NIH had more than 1,100 PhD staff departures in 2025. These were program officers, scientific leads, and institute directors who carried institutional memory about ongoing grants, research priorities, and how to navigate the system. And when that kind of knowledge walks out the door, it doesn't come back quickly. NIDA and NIAAA were among the institutes most affected. Next slide. Now let's talk about what happened to the grants. Between February 28th and April 8th of 2025, just 39 days, 79 active addiction research grants were terminated at NIAAA and NIDA. These weren't failed grants, they were productive, peer-reviewed, funded science that was simply cut off. The data on this slide come from Liu et al., published in JAMA of August 2025, but because their accounting was done before the fiscal year reconciliation, we think it represents an underestimate. More recent analyses suggest grant determinations were much higher. So, for example, a report released by Zhu et al. In 2026 counted 111 terminated grants at NIDA alone. The mechanism for cancellations was crude. DOJ flagged grants containing certain words, primarily DEI adjacent language. The human and scientific cost is enormous. For longitudinal studies and clinical trials in particular, abrupt termination doesn't just pause the research, it often destroys it. You can't restart a 5-year cohort study halfway through. The investment of the prior years is simply lost. And when the courts ordered reinstatement, the chaos of stopping and restarting also has costs. Staff were let go, participants dropped out, and data wasn't collected on schedule. Next slide. The grant terminations were devastating, but they're only part of the story. The pipeline for new grants has also collapsed. This chart shows data from the NIH Reporter. It shows the combined number of new grant awards from NIDA and NIAAA over time. As you can see, in 2025, they awarded the lowest number of new grants since 2000. That was a 30% decline from 2023, just despite having a similar appropriation level. These awards are the studies that will produce knowledge 3, 5, or 10 years from now. When this pipeline shrinks this sharply, the effects will compound for decades. Next slide. Now, before you can lose a grant, you have to lose the invitation to apply, and that's what this slide shows. Notice of funding opportunities are announcements that are used to invite researchers to apply for funding. In 2025, that pipeline is essentially closed. NIAAA published 0 new solicitations. NIDA dropped to just 9, down 89% from its 2017 peak. And NIH also stopped publishing the NOFOs in the NIH guide. They moved the solicitations to grants.gov and added a 6 to 12-month lag under new political approval requirements. No new institute-specific announcements means no applications can be directed to gap areas that NIDA and NIAAA scientists deem critical. It also blocks the issuance of targeted funding opportunities for congressionally mandated research programs such as the BRAIN Initiative or the HEAL Initiative. These changes signal to researchers that the field is no longer open for business. Next slide. There have been 4 structural changes in how NIH operates that represent a fundamental break from the 70 years of scientific independence. First, political appointee control. All funding decisions now require final approval from a political appointee, who, by executive order, is instructed not to defer to peer review. Second, retroactive alignment review. Grants that were previously reviewed, properly approved, and properly funded can now be canceled if the administration decides they don't align with their priorities. Third, language policing. The administration has required active funded researchers to scrub specific terms from their grant titles and aims. Terms like disparities, equity, structural racism, and gender. And fourth, an advisory council crisis. By law, NIH cannot approve new grants for funding without functioning scientific advisory councils. Since January 2025, very few new council members have actually been added across the NIH advisory councils. And some of the advisory councils are now being filled with friends and family of the Trump cabinet. If NIDA and NIAAA cannot fill their councils properly, they may lose the legal authority to approve new grants starting in 2025. Next slide. This slide ties the workforce cuts and the grants disruptions together. The line shows scientific publications produced by NIDA and NIAAA funded grants from 2021 to 2025. For 2 decades, the trend was upward. More funding, more science, more publications. 2025 breaks that trend sharply. We estimate a 24% decline from the 2023 peak and the steepest single-year drop in the 25-year period. We found a correlation of 0.87 between funding levels and publication output. Funding and science production move together. When you cut the funding and disrupt the infrastructure, the knowledge gap stops flowing almost immediately. Next slide. The previous slide showed cuts to volume, and this one shows the deliberate erasure of an entire research topic. The line tracks the NIDA and NIAAA grants that included the word gender. 2025 had just 24 grants across both institutes, the lowest in 25 years. Executive Order 14168 effectively erased gender as a legitimate research topic. Let me be clear. Sex and gender are not political categories in addiction science. They are clinical ones. They shape how people metabolize substances, whether they seek treatment, and whether they respond to it. Erasing the word doesn't make the science go away. It just means we stop doing it, and this will cost lives. Next slide. In just 1 year, the Trump administration has inflicted a complete crisis on the addiction science infrastructure, and sadly, they're not done yet. The White House 2027 budget proposal seeks to merge NIDA and NIAAA into a single new entity called the National Institute of Substance Use and Addiction Research, and with significantly less funding than they have right now. Also, the budget proposes to give a 7.7% cut for the NIMH, and this is really part of an overall plan to cut the NIH by over 12%. Congress rejected similar restructuring last year, so the outcome is uncertain, but it does signal their intent to downsize the scientific infrastructure that addiction research depends on. So now I'm going to hand it off to my colleague, Rob Vincent. He's going to walk you through what's happening beyond NIH.
Thank you, Liz. So for more than 50 years, a community of scientists, researchers, prevention specialists, and clinicians have really grounded addiction policy in evidence. It's given legislators a reliable basis for appropriating public health funds and getting outcomes. That foundation is now under direct assault. In January of 2026, SAMHSA terminated up to $2 billion in congressionally appropriated grants across more than 2,800 awards. Effective immediately, with no prior warning, no consultation with authorizing appropriation committees. Grantees were told no corrective action is possible. Termination is irreversible. The language was designed to foreclose appeal. And it effectively nullified the legislative intent behind those congressional appropriations. These grants funded the prevention system, overdose prevention in rural communities, naloxone and first responders, homeless outreach, and peer recovery for formerly incarcerated, serving constituents in districts across both parties who've had no alternative safety net. After a public outcry, some of those grants were partially restored, but the restoration was incomplete. Hundreds remained canceled. Staff had been laid off. Clients turned away. Continuity of care broken. These are sunk costs that cannot be recovered. Colorado alone stood to lose $250 million in federal support. As Representative Peterson stated, The administration is dismantling the very systems that have helped support people to get treatment that they need. This was the opening act. What followed was a deeper structural assault on SAMHSA itself. In my next slide, treatment safety net, we can look at how this impacts SAMHSA. As you know, SAMHSA is the agency Congress established to lead the nation's behavioral health response. It has now been systematically dismantled on three fronts. First, on the funding front, $11.4 billion in COVID-era grants rescinded, congressionally appropriated funds supporting active addiction studies and treatment programs across the country. The federal investment was already made. These programs are now stranded. Second, the workforce. 2/3 of SAMHSA staff have been terminated, including over 100 program officers who manage grant portfolios and maintain the relationships that translate federal dollars into state-level results. Rebuilding that capacity will take years and significant new apportions. Third, independence. As Liz said earlier, there's a big consolidation going on. HHS consolidation is merging behavioral health functions into broader structures, undermining the dedicated agency model Congress specifically authorized. And then critically, SAMHSA's national data infrastructure is being destroyed. The three systems that Congress relies on to evaluate its addiction investment, the first one being NSDA data, or the National Survey on Drug Use and Health. That survey serves 70,000 Americans annually. It directly informs block grant formulas that Congress uses to allocate funds to states. Without it, you can't really verify whether substance use is rising or falling. TEDS data tracks admissions into publicly funded treatment facilities. It's how appropriation committees assess whether treatment system is reaching the population's federal dollars target. And then lastly, DAWN, the Drug Abuse Warning Network, that monitors drug-related ER visits. It's the early warning system that lets Congress respond proactively to new drug threats rather than reactively after mass casualties have occurred. When these systems go dark or there is question about the quality of the data, Congress loses its data and its ability to legislate effectively on substance use. And in my next slide, we'll talk about real programs, real people, and real consequences. Each program on this slide was authorized and funded by Congress. Each is now being dismantled through executive action. And in every case, the data system that would justify restoration are being destroyed simultaneously. Drug courts which have given us proven alternatives to incarceration, costing a fraction of the $35,000 to $40,000 a year to jail someone, halted nationwide. The TEDS data, treatment episode data set, system that demonstrated their effectiveness before appropriations committees is now being dismantled. That program, the programs are gone. The evidence to restore them is being erased. Fentanyl test strips, pennies per strip versus thousands per ER visit. Federal distribution ended. Meanwhile, DAWN, the system that detects emerging drug threats in emergency rooms, is going dark. The frontline tool and intelligence behind it are both gone. Jail-based treatments. 65% of incarcerated individuals have substance use disorder. Programs losing funding despite bipartisan support through the First Step Act. NSDA, which has provided us that prevalence statistic that we all use, both in applying for grants, it's being disrupted. So the future advocates won't really even be able to quantify the problem. And lastly, it's worth mentioning, most of the behavioral health dollars and treatment has been publicly funded. Medicaid proposed $1 trillion in cuts, threatening the single largest payer for addiction treatment. Every dollar that MOUD returns is about $4 to $7 in savings. The BRFIS data set, the system that states used to estimate how many residents need coverage is being undermined. So states will have to cut programs that they no longer can accurately size. This is a compounding effect. Programs are being cut, and the data to justify restoring them is being dismantled or has integrity problems. All of this is happening simultaneously. You cannot appropriate what you cannot justify. You can't justify what you cannot measure. And in the next slide, we'll turn it over to our good friend, Dr. Jeremy Bray. Oops, I'm sorry, I got ahead of myself. I have one more slide here, my apologies. Let me speak to the disruption to the wider federal damage. This disruption is not just confined to SAMHSA. Every major federal agency with addiction responsibilities has been hit simultaneously, spanning multiple committees and jurisdictions. HRSA, the Health Resource Services Administration, addiction treatment in underserved and rural areas impacted. When federally funded rural treatment center loses its grant, there may not be another provider within hundreds of miles. The federal investment is essentially stranded. Department of Justice, drug court funding curtailed, undermined decades of bipartisan criminal justice reform and institutional infrastructure Congress built throughout the First Step Act. CDC, the surveillance programs altered or frozen, and 3 critical data systems threatened. BRFIS, more than 400,000 adults surveyed annually. The basis for federal funding formulas Congress established. Without it, states cannot implement the programs that you fund. RD data quantifies that alcohol kills 140,000 Americans annually. And actually the new number for that is 178,000. The first impact tool for alcohol prevention policy. Without it, the economic case for prevention disappears. CDC's Wonder data set, the public data set your staff used to direct for district level overdose briefings. When this data is frozen, members lose their most powerful tool for arguing for their constituents. Internationally, we've pulled away from WHO. Withdrawal from USAID has dismantled or weakened coordination among drug supply chains and trafficking. The upstream forces determined that reaches American streets. Taken together, these 6 surveillance systems, NISDA, TED, DAWN, BRFIS, ARDI, and CDC Wonder, they're the entire national data architecture for addiction. Dismantling them erases the baseline against future legislation will be measured. If Congress cannot access data to evaluate outcomes, the power of the purse becomes an exercise in faith rather than evidence. And with that, let me turn it over to my friend and colleague, Dr. Jeremy Bray.
Thank you, Rob. Now that we've seen how the administration's actions are impacting the addiction science field, let's take a moment to think about how those actions will also impact taxpayers and our economy. Next slide, please. To understand how the administration's cuts to addiction science may impact the American taxpayer and society more broadly, we first need to think about how addiction science benefits our society. It does so in at least 3 ways. First, like all government spending, funding for addiction science research contributes to our GDP and so promotes short-term economic growth. Second, government funding of basic science and discovery is a key driver of economic innovation that promotes long-term growth. And then third, spending on addiction research helps develop more cost-effective approaches to addiction treatment and prevention that, in turn, reduce the addiction-related costs borne by taxpayers. These costs arise because addiction causes increased health care, criminal justice, and other social costs that make their way to the taxpayer. Let's briefly look at each of these mechanisms in a little more detail. Next slide, please. Let's start with the short-term economic impact of research funding, and Liz touched on some of this already. Every time the federal government spends money, that spending has a ripple effect throughout the whole economy. When a researcher buys lab equipment with a research grant funding, the lab equipment supplier gets income that then they go out and spend on other things, which then gives income to someone else, and so on. And the same applies to paying research assistants, providing incentives to research subjects, and everything else that research funding gets spent on. Economists have several ways that we can trace these ripple effects throughout the economy, but one of the most common ways is to use what's called an input-output model that uses aggregate spending estimates by different industries to track the flow of money across these industries. These models can then be used to estimate how much economic activity is generated by an additional dollar invested in a research grant. Since 2012, United for Medical Research has used input-output models to estimate the economic impacts of NIH research funding. In their 2025 report, they estimate that every $1 of NIH funding generates an additional $2.46 in economic activity and over 400,000 jobs. Now, that's for all of NIH, but if we consider the $34 million of NIDA and NIAAA grant funding that was delayed or terminated in early 2025, cuts to NIDA and NIAAA may have already cost us over $87 million in lost economic activity. And that does not include the negative economic impact of the layoffs and job cuts that Liz told us about, or the impact on the data infrastructure that Rob talked about, nor the slowdown in spending by researchers that do not get grants on time or that are worried about losing grants, and that likely is likely happening because of uncertainty in funding levels and timing. So although some of these grants may be reinstated, we can ensure that the administration's cuts to addiction science are causing a drag on the economy that are impacting all of us. Next slide, please. As big as the short-term economic impacts may be, the long-term impacts are even bigger. For a little background, towards the end of World War II, economists working with the federal government suggested that federal funding of basic science could promote economic growth in a way that only public funding could do. The idea is that basic science produces knowledge that cannot be immediately privatized into a business. This knowledge is a kind of public good that helps everybody. But because it does not generate private economic benefits, private firms will not invest in it. Only the government will fund this kind of knowledge generation. And yet this basic knowledge creates new investment opportunities that can have private returns. And so it spurs additional research and development by private industry that in turn creates new jobs and grows the economy. This idea was the basis for the creation of the National Science Foundation and the NIH. More than 50 years of economic research shows that the economic growth created by government investments in basic science and discovery is much, much bigger than the initial investment. For example, a recent study conducted by the Institute for Macroeconomic Policy Analysis found that, over the next 20 to 30 years, a 50% cut to the NIH budget would reduce U.S. GDP by 3.81% and federal tax revenues by 4.15%. For perspective, a 50% cut of the current NIH budget is about $24 billion. And 3.81% of the US GDP, that's about $1.16 trillion, nearly 50 times greater than the cuts to the NIH budget. And 4.15% of federal revenues, that's about $216 billion, or 9 times greater than the cut to the NIH budget. If we focus only on NIDA and NIAAA, a permanent 50% cut to their budgets would save about $34 million per year, but cost the economy about $1.6 billion in lost GDP and reduce federal revenues by about $300 million per year over the next 30 years. Next slide, please. So far, I've talked about the economic impacts that come from cuts to the federal spending that apply to all science funding, but are not unique to addiction science. But addiction science is about addressing the health and social harms caused by addiction. And so cuts to addiction science have economic implications that cuts to other types of science funding don't have. In 2017, substance use and related costs cost the U.S. an estimated $740 billion, driven by alcohol, illicit substances, and tobacco. And reducing these costs has long been a motivator for public funding of addiction prevention and treatment services. We know from decades of research that effective prevention and treatment are associated with huge savings, anywhere from $100 to over $100,000 per person after accounting for the cost of the prevention or treatment program itself. Critically, much of this economic benefit accrues to people other than the person being served. The largest source of economic savings come from criminal justice costs, with most of the benefit going to the victims of crime. Yet these economic returns from prevention and treatment are not guaranteed. Ineffective programs do not save money. Federal funding of addiction science helps us improve both the effectiveness and the cost effectiveness of prevention and treatment services. Finding better prevention and treatment approaches for vulnerable populations or that better account for the socioeconomic situations of the people receiving services not only helps save lives, it helps save money by creating more efficient ways to address the addiction and the harms addiction creates. Next slide, please. In summary, we know that addiction science not only saves lives, which really should be enough to justify continued funding, but it also improves the economy and saves money. But to ensure the greatest economic return from this funding, we need to be sure that the funding is focused on generating basic scientific knowledge and on finding the most effective prevention and treatment approaches possible. And to do that, funding decisions need to be based on science, not politics. Thank you, and I'll now turn it over to Tom for conclusions and recommendations.
Thanks, Jeremy. So, how about some conclusions and recommendations? So far, you've heard the highlights of our report on the impact of the first year of the Trump administration or the second Trump administration. My task now is to bring together the pieces that have been so effectively described and discuss their implications for addiction science and public health. Some of the actions that we have described seem unwise. Others seem unethical. A few of them are possibly unconstitutional, and many are unscientific. Most of them seem detrimental to the field of addiction science. And these are the ones that took place and were implemented and have impacted the field just during the first year of the administration. Since that time, there have been a number of other actions introduced in the federal government's vast array of programs and policies that continue the impacts that have been described in our report. So we're likely to have to consider continuing our work to monitor on a daily basis what the administration is doing. But what you see here is the implications of these actions. Ending DEI programs could exacerbate existing health disparities. Withdrawing from the World Health Organization will impact access to global data about diagnosis and classification of all kinds of alcohol and drug-related diseases. Under the strange rationale of gender ideology extremism, the administration's attempts at controlling the use of terminology in grant applications and scientific articles and services for gender diverse populations will stifle scientific communication. And realigning foreign aid for HIV programs, particularly in Africa, are already leading to increases in mortality to children. The drastic cuts in personnel at NIDA and NIAAA are leading to fewer publications, and the cuts to Medicaid that have not yet been implemented but are due to come online soon are likely to affect access to alcohol and drug treatment. So there is plenty of lab damage that's already been done. And in the past 2 months, since we have tried just to understand the impact on the first year of the first year activities, we've identified a number of other things. The fact is that we've never seen this kind of dismantling of key components of a scientific field, especially a field that is crucial to the health of all segments of the US population. As the next slide shows, the siege continues. Example, this week there were a series of announcements from the administration that are confusing, difficult to interpret, sometimes promising, but often inconsistent or contradictory. We've already mentioned the NIAAA NIDA merger plan. It was announced in more detail this week in the context of the fiscal year 27 budget proposed by the president, although this would require an act of Congress, which may be unlikely. Here we have two historic institutes with a combined $2.26 billion budget being reorganized into a newly created institute where the budget document provides no scientific justification for this merger, no evidence of duplicative research and waste, no program evaluation showing inefficiency, no expert panel recommendations, and all of these things would be typical of the kinds of reorganization proposals for the NIH in the past. This week, we also heard from the National Office on Drug Control Policy. And the new drug control strategy was described in an article in a headline by KFF News in the following terms, quote, Trump's drug strategy aims to bolster addiction services. That sounds good. But the headline also said, despite gutting government support. The examples in the article show that the strategy states things like rapid test strips and similar technologies to identify fentanyl. While they are considered to be positive things that the drug control strategy is supporting, the Trump administration has shifted away from these things and taken away the ability to fund drug test strips. And the rationale in other government documents has been that harm reduction facilitates illicit drug use, for which there's little or no evidence. Another part of the strategy deals with access to medications for opioid use. It's supported in the drug control strategy, but there have been policies now implemented in Medicare which supports medication-assisted treatment, which start in 2027, where every 6 months somebody on buprenorphine will have to come in to reevaluate whether they should continue. And people in the field are very concerned that this is going to discourage people from applying and continuing to be maintained on opioid medication treatment. So we've got a number of different activities that the administration is pursuing on the one hand, but cutting and withdrawing support for on the other. Uh, Rescheduling of psychedelics and cannabis could be good for research, but not necessarily when the main recommendation for changing the policy on psychedelics comes from uh, a uh, uh, a guy who runs a radio program who happens to be friends with the president. So there are lots of contradictions. Removal of tariffs on Scotch whiskey. Well, that might be good for some economic sectors, but it's not good for uh, alcohol policies that have been shown to be effective when the price of alcohol is increased. And tariffs are good for public health. And by changing tariffs on um, substances like whiskey, we could be contributing to alcohol problems. The FDA commissioner just this week issued its first authorization of flavored vapes for adults. That might help small numbers of people using uh, nicotine in vaping devices to withdraw from nicotine dependence. But we have an epidemic of vaping among middle school children and and high school students who have become addicted in part because of the activities of the tobacco industry, who have been lobbying the federal government to uh, liberalize restrictions on vaping under the justification that it helps to prevent nicotine withdrawal. So, what can addiction science do to defend itself from these kinds of government interference where uh, evidence-based policy is contradicted by policies implemented in a haphazard way by different parts of the government based on political considerations and ideology? The piece by piece dissemination of addiction science infrastructure that began over a year ago is particularly difficult to understand because it comes from the federal government itself. And now the community of scientists is being treated like we're parts of a wasteful bureaucratic entity in need of downsizing, cost control, and political oversight. To deal with the situation, the Addiction Science Defense Network has initiated a variety of measures to respond to the immediate threat. And during the past year, we've done things like issued a clarion call editorial signed by 29 current and former addiction journal editors. We created a website to serve as an information dissemination platform. We send out weekly updates of new information gleaned from a variety of reliable sources, and you can easily get free copies to send to your inbox of our weekly update. We issued a statement of concern, a public letter endorsed by the leaders of 31 national and international organizations representing more than 32,000 addiction scientists, health practitioners, and policy experts. We've written op-eds, We're trying to network with other organizations. And with the release of this particular report, Addiction Science Under Siege, we're going to be sending it to all members of Congress to alert them to the continuing threats to public health. Despite our best efforts, this has not been enough to slow down the juggernaut. We've been doing this with a group of unpaid volunteers. It's time for other organizations and other people to join this effort. The next slide shows what you can be doing. Enforce congressional control over approved federal funds. We need the support of members of Congress, their staff, to use the constitutional powers of Congress to deal with the reductions in funding that have not been authorized but have been approved. We can be doing more to monitor effects on patients and programs and scientific productivity, which we will continue to do, but we're going to be needing help. We need to protect the peer review process that is now being subjected to ideological review at just about all levels of the application process, starting with the submission of grants and winding up with political or review by political operatives just before funding. We need to safeguard Medicaid, whose effects on access to treatment are going to be huge, and expand, not contract, support for SAMHSA and CDC. So if you have the time, the relevant skills, the motivation, please get involved by reading our recommendations for different stakeholder groups. It's at the end of the report, and it provides a menu of options which everybody can contribute to. So now, what can we conclude from what we've learned? Well, one thing is that addiction science is more than a collection of individual scientists and research programs and grant funded activities. It is a transdisciplinary field of study that took 50 years of federal investment to build into a living, interacting scientific network dedicated to public health. And it's going to take a long time to put that back together again. But since the network is now under siege, the more important question is, what can we do to stop the actions that are being subjected to the field on an almost daily basis? The field has become already seriously compromised. So finally, here's the message. It took billions of dollars of bipartisan investment to build this infrastructure. It's being dismantled without an explanation or a clear rationale. The overdose crisis has not ended in the last year. Fentanyl has not disappeared. Families are still losing their kids to drugs and alcohol. The question this report raises is whether we have the science, the data, and the treatment capacity to respond. We have it. It needs to be ongoing, but we may not have it if we have already begun. We've already begun to surrender the tools that we need when we need them the most. So with that, I'm going to conclude on an unhappy note. I hope that your questions, your statements, your comments at this point will give us some hope that there's support out there for what's being done and what could be or should be done next. Sheila?
Thank you all so much for your powerful presentations and for the hundreds and thousands of hours that each of you probably spent combined, along with the collaborators on this report, to pull together this analysis from all these disparate places, to really kind of tell this cohesive and devastating and heartbreaking story to our audience today and to all the readers and viewers of this recording in the future. So I want to just take a moment to thank you so much for your efforts, those of you on the line today and the collaborators who were not able to join us, because I think for a lot of us, we had a sense of what this loss was. But I think for me personally, I mean, I have a lump in my throat just even hearing all of you together over this past hour, just really laying out the ways in which our field of addiction science has been so gutted and harmed. So thank you so much for that. We have about 25 minutes remaining, and actually, our audience members have been adding questions to the chat and the Q&A box. But I did prepare a few questions, and if I can just ask two of them to kick us off, but then I think we might be able to actually get to some of our engaged audience questions. The first thing I wanted to ask is one thing that's unusual about this report is that it was not only written by academics and researchers in the field. What's unique about this collaborative team of co-authors is that it also includes two people who themselves were impacted, who were members of the federal workforce, and who were no longer part of the federal workforce. And I was wondering if each of you could take a moment to kind of talk about what this past year has been like and what you've done to channel that energy into something like this, but also the other projects that you have underway.
Yeah, so you're definitely referring to myself and Rob. I was at NIH for 22 years as a program official, and I decided to skip out and take the early retirement a year ago when it became clear that my job as a program official would involve screening grants for bad words and canceling grants. And we were basically expected to no longer write funding opportunities anymore, but rather spend our time responding to these political demands. And I couldn't see a world where I would feel comfortable playing a role there and took the escape. Since I left, the local job market is horrible, so I channeled my energies instead to volunteering activities like ASDN, and I took to writing about my experiences on Substack. So if anyone's interested to see what I've been up to, head on over to Substack and you'll see what I've been doing.
Well, thanks, Liz, for sharing your story. And mine's slightly adjacent to that. I was the former Associate Administrator for Alcohol Prevention and Treatment Policy there at SAMHSA. And in an effort with industry meddlings, because we were asked by the principals of the former administration to produce a report to help inform the U.S. dietary guidelines, it turned into suppression of the science and the data. And I was essentially forced out in that process for no apparent legitimate reason. All of the grants and everything that I managed before, I served as the staff chair for the Interagency Coordinating Committee for the Prevention of Underage Drinking. Those 24 federal agencies are still continuing to meet and do their work as best they can in spite of interruptions in the entirety of the system. But mostly, all of the work for the reports to Congress and the community coalition grants and all of those things still exist. So essentially, they just needed to get rid of me because we published a report that was rather inconvenient. And the industry spent about $25 million to make sure that I was sidelined. That's a very unfortunate. This gets to some of the things that Tom, Liz, and Jeremy have all spoke to. When we allow undue influence by ulterior motives, this becomes very problematic. And that the data becomes inconsistent or that we get junk science. And that really is the problem from my chair that, over the last 50 years, The community of researchers, practitioners have worked very, very hard to have evidence-based policy making, solid data sets, and integrity in the science, with huge debates on the quality of various studies, etc. Rightly so. And so when you publish something that's a little inconvenient and counter to what the administration wants, if you look at the current draft of the U.S. Dietary Guidelines for alcohol, you'll notice it's a pretty light read. And I'm not sure will effectively change much, frankly, other than maybe some profits. So, anyways, that's my story. I'm sticking to it.
Thanks, Rob and Liz. Um, Tom, I want to pitch a quick question to you. So, one thing that you all have done, even in advance of the report launch, is shared the report with various professional institutions and opened up for endorsements. And I was just wondering if you wanted to speak to how many folks have been mobilized by the report already. Any rough estimate? I know that Denny is also still encouraging folks in the chat if they would like to endorse the report, but what response have we already received on the report? There was a Huffington Post article that came out today, if my colleague Angel can drop the link in the chat. But Tom, can you tell us a little bit about how people have already responded?
Well, it's encouraging that 21 organizations and several more pending, including the large research societies, have endorsed our letter to Congress. And we've got favorable responses to the report from medical journalists who are interested in writing about it. So I think that at the very least, we've demonstrated that it is possible to conduct what we in the public health field call public health surveillance. We're monitoring the situation and using our research skills in order to document damage. And it's providing us, I think, with some insights into how the field works and how it operates. So some of the stuff coming out of this is positive, and at the very least, we're going to be able to inform the public that in the long term, these kinds of activities are not good for people in their communities, most of whom are affected one way or the other by addictive substances.
Yeah. Thank you, Tom. So, Jeremy, one of the questions that I'd prepared in advance was asking each of you to speak about, I'm sure that at the onset of this project, you anticipated finding a number of really troubling and disturbing trends in the data, in the cuts, in the scale of the impact. But doing the economic analysis, can you talk a little bit about the disparity between what you expected and what you actually saw? Did you expect to see this scale when you actually looked at the final numbers? What was that like?
Yeah, so I've got over 30 years of experience in doing economic evaluations of substance use prevention and treatment programs. And so the findings on the return on investment of specific programs did not surprise me at all. I knew they were always a really good value and well worth the money. I've done a little bit of work around economic impact of specific initiatives, and so I wasn't that surprised that the NIH had a $2.56 return for every dollar invested. But despite being actually good friends with one of the world's leading economists on innovation and discovery, I did not expect the size of the impact that reducing basic science funding at the federal government level would have. I knew conceptually that it was a major driver of American economic growth since World War II, and for that matter, of the Western economy's growth. All of Europe has benefited from America's investment in basic science funding. The NSF, and in particular the NIH, are just such huge generators of economic growth and innovation. And just was staggered that we could reduce GDP by 50 times more than the money we think we're saving. It's cuts to NIH would have the effect of a great recession on the U.S. economy in 30 years. Now that we don't; those aren't going to happen immediately, right? This is bending the curve. So 30 years from now, we won't be where we could have been.
Hmm.
But we think back about how far we've come and in areas related to addiction, to vaccines, you know, um, eliminating smallpox globally. That is not something that any private firm is going to do. You need federal government spending. And to Liz's point about advisory councils and funding opportunity announcements, we need somebody putting some thought into where's the next urgent issue. Is it hantavirus? Is it COVID? Is it fentanyl? All of these things are issues, and I was really surprised at the potential magnitude of the loss we're facing that my grandkids are going to have to deal with.
Yeah. Yeah. Thank you. Thank you so much, Jeremy. So I'm going to go to some of the questions that we already started receiving from our panelists, and I open it up to anyone who feels like they can respond. So we got a question from one of our attendees. How do you regain or restore institutional knowledge that was lost due to people leaving these institutions? Are there certain kinds of knowledge that are more valuable than others to restore? How would you identify, prioritize, or do that? And Liz, I think I just saw you get off mute, so if you'd like to jump in.
That's a hard question. I think Rob may have something to say too. One of the things the first actions that was done, at least at the NIH, was to completely eliminate all of the communications and FOIA staff. And they centralized all control of the messaging, of the narrative. And I think that was really sort of, for people who are paying attention, a a real bellwether of what was going to happen next. We as program scientists are critical. The review officers are critical. The grants managed people are critical to getting grants out the door. But ultimately, all the science that gets funded by the NIH, if we can't talk about it, if we can't disseminate it and speak to the public about it, it's almost pointless. So I think it's hard to say that some kinds of positions are more valuable than others, but the theme across all of it is this censorship. And the main thing I would say is NIH was designed by statute to be run by scientists, not by political people. And that's what you need to get the advances that we have seen over the past 70 years.
Mm-hmm. Rob, do you want to jump in?
Sure. And I'll just build off of something Liz said that I think is important. And I tend to view sort of the work of the system really as a diamond, and that there are multiple facets on this diamond. And in order to have a diamond really have brilliance and fire and all of the things that would make you want to buy that, it takes all of these things. No one's really more important than the other, but they all do work together, even if you can't see how they're connected. And that is in part the thing that when we talk about the loss of institutional knowledge, I think we're going to be decades coming back to this. There will be some things I don't know that will be recoverable, but we'll certainly do our best. I think those of us who are volunteering our time and doing whatever we can on the edges of this thing to help support are all in it for the long term. Because I think what's ultimately at risk is going back to the dark ages of how we used to treat mental illness and substance use and addiction before we had good prevention science. And I gently say people were making things up as they went, thinking they were good ideas. And I fault nobody, but that's the point around having good evidence-based policy making and science. in how that something that Tom spoke to earlier, especially in the space of alcohol. There are 27 policies that are considered evidence-based policies that have literally had the largest decline and shown the most progress, bar none, of any prevention program we've ever had over the last 3 decades. We've had great successes in underage drinking. All of that is essentially, in my view, likely to be wiped out. So
Mm,
with that, I'll yield to others.
yeah. Well, I'd love to pull Tom in to talk a little bit about piggybacking off of these two responses from Liz and Rob to this question about another project that you all at ASDN are going to be working on now, this idea of the Build Back Better. What does it look like to move forward? And I was wondering if you might give a sense to some of the members of the audience of how you all are starting to think about even proposing or having these conversations.
Yeah, we're looking for expertise in all areas of addiction science that can be used to evaluate how the current infrastructure works and how it can be improved, especially what are its current limitations and things that don't work. So it's not only reconstituting the existing system that we have to consider, it is how can we reconstruct it into a more well-functioning entity that takes advantage of how science works and is responsive to the environments in which it operates. There's a political environment, so it needs to be independent, but there's also this huge environment called American history. And that brings with it new drugs, new types of addictions, new discoveries. And we have to have a system, an infrastructure that's flexible, capable of rapidly responding, and it has the expertise available in all of the areas where expertise is going to be needed, ranging from the people who know enough about uh, chronic diseases, dementia, Alzheimer's disease, and how they interact with the use of addictive substances to the environments like raising and lowering taxes on
Mhm.
tax rates that nobody considers might have an effect on the price of alcohol that's going to affect young people going into a store and buying, a case of beer.
Yeah, yeah. Thank you.
So we're looking for people who would join this effort to build back a better system. And it's called the 3Rs Project. And you can send an email to me or anybody on our website, and we could probably find a place for you. We're not only looking for scientists, we're looking for people who are in recovery, we're looking for treatment practitioners. Anyone who's part of this field can make a contribution.
Thanks so much, Tom. I have a question looking forward from one of our pre-prepared questions. Um, how should early career addiction scientists in various fields and professions weigh the decision to stay in the field or enter the field when we've seen such a dramatic reduction in new awards, but also just the broader infrastructure for the field of substance use, whether it's prevention, harm reduction, overdose prevention, treatment, what have you? What advice do you all have at this stage in your careers, but seeing the impact that this is going to have for generations to come?
I'll jump in on that one. The funding is definitely harder now. I do believe, probably hoping against hope, but it will get better. But I don't know that it's going to be what it was. With that said, I don't think very many people in this field got into this field because of the funding. They got into this field to make a difference in people's lives, to have an impact. And that impact is greater, can be greater now than it's ever been, I think. And there is now a potential to really make a difference. I work at a regional university, and I reflect on this all the time when comparing where I am to flagship universities, to the Harvards, to the Carolinas of the world. The kids who go to those places are going to do well no matter what university they go to. But the kids who come to me, to my university, I can make a difference in their lives. That's where we are in addiction right now. Right? We now have the opportunity to really have an impact. It's going to be hard. It's not easy. We've lost a lot of the resources we need to make that impact. But because we've lost those resources, our ability to make an impact, I think is even bigger than it's ever been. So no, it's not going to be an easy career, but I think it will be an incredibly rewarding one, and I hope people will continue to pursue it.
Thanks so much, Jeremy. So we just have 4 minutes left, and I wanted to give each of my panelists 1 minute to make a closing remark, to send our audience off after this, and to encourage them to move forward in any way. So, Liz, would you mind going first, and then I'll just pass the mic until we get to the end.
Sure. I'm grateful for the opportunity to work with ASDN and the Prevention Science Coalition. I've spent my entire career focused on prevention and science, and it was not my expectation that I would leave government service when I did. I thought I'd be there for at least another decade or so. So I'm still figuring out what's next for me, but there are, I think, a lot of smart people out there who are putting those thoughts together, and we need more of you to join us and think it through. And in the meantime, if you want to know about the nitty-gritty secrets about what's happening inside the NIH, I've become the NIH Inside Whisperer, and follow me on Substack because I'm going to give you all of the things that they can't say. I'm writing about. So I have a big scoop that I think I'm going to drop tomorrow.
Thank you so much, Liz. I look forward to reading it.
Mhm.
Tom, would you like to go next with a last
Okay.
1 minute?
Well, the field is under siege, but many people in the field have either ignored the warning signs and figured that just by lying low and waiting it out, things would get better. Uh, that's not going to help. It's not going to work. Uh, and the fear of intimidation that we've identified not only among individuals, but among organizations that are not speaking out. Our journals, very few editorials in our journals about this situation. Uh, the professional societies, the journals, uh, and the scientists in the field need to become much more active in defending addiction science, promoting it, and pushing back when they encounter unethical, unscientific, and um, uh, other activities that are affecting our ability to produce actionable knowledge.
Thank you so much, Tom. Rob, and then we'll close out with Jeremy.
Sure. I'm going to ask people to dig deep, find your voice. For those who are leaders, the burden of leadership weighs heavy on everybody. But the point of leadership and being a leader is to find your voice and do the things that are often the most difficult. That's the job. Unfortunately, I haven't seen a lot of that in recent times. For my community friends and colleagues, this is a time where everybody has to dig in. We need to come in, rally, volunteer, do work. We need to find our voices, communicate to our congressional folks, run for an office, do something to try to make a difference here. Because if we don't, What's at stake is virtually everything. And we have seen moments in time in our history, to Tom's point about our history, new drugs, new things that have led us down dark roads. And I, for one, would love that my two granddaughters don't have to experience that. So that's why I'm here, and I'll
Thank
pass to
you.
Jeremy.
And Jeremy, even though we went slightly over, I
Uh,
have a feeling people will stay to hear what you have to say.
oh, well, thank you. And I suppose my parting comments are a combination of Tom and Rob's. When Tom first asked me to get more heavily involved in this effort, I talked with my wife because the fear of retribution is very real. Uh, and we came to the conclusion that 20 years from now, when my grandson asks, "What did you do at this moment in history?" I don't want to say, "Well, I kept my head low and hoped it went away."
Hmm.
I want to say I did something. Uh, it- I'm an economist working in addiction science. This is what I can do. To those on this call, do what you can do, but do something. To Rob's point, speak up. Do something, find a way to make a difference.
And on that note, thank you all so much for joining us live today. Thank you so much for those of you who are going to be watching the recording. Please share the report, the recommendations reports, and the recordings in your networks. And please engage with all of our various groups in the future. We welcome you to be part of these coalitions because that's the only way we're going to be able to move forward. So please join me in thanking our panelists. And we hope you all have a safe rest of the day. Thank you so much.
Thank you. Bye bye.